Do you want me to stay better on the chair?
No, just for you.
Oh, yeah.
We're going now. Okay. Hi, my name is Jessica. I'm a nurse practitioner. I'm going to be doing your physical exam today. So first we'll start off with your visual acuity test. I'm going to go ahead and give you this card. Cover your left eye and let me know what letters you could read on this line right here.
PKUEOSTVXRNJHCAZZI.
Okay, very good. Now cover the other eye and go ahead and read the same line.
PKUEOSTVXRNJHCAZZI.
Okay, very good. So that's 20/20 vision. You only missed one letter. Okay. So now what we're gonna do, is if you can move to the bed for me. I'm gonna go ahead and check your hair and your head first. I have a good normal shaped head, normal cephalic. I'm gonna go ahead and look through your hair. Good distribution of hair, nice, thick, shiny hair. Let me know. I'm gonna palpate your head. Let me know if you feel any pain.
Okay. No.
Any pain?
No.
No? Okay, so now I'm going to go ahead and feel your lymph nodes. If you could bring your head forward for me. So we'll feel the occipital lymph nodes. Palpable. Postauricular, preauricular, tonsillar, submandibular, and submental. They are non-palpable. Okay, and we'll go ahead and feel your cervical lymph nodes. So we'll feel the anterior superficial, posterior superficial, and your supraclavicular. They are non-palpable at all either. And while we're here, we'll go ahead and feel your axillary lymph nodes. Any pain?
No.
Okay. And the ventricular? They are non-palpable. Okay, so we'll go ahead and feel for the other side as well. Tender or just tickle?
Tickle.
Okay. And the epitrochlear? And they are non-palpable also. Okay, very good. If I can have you, I'm going to feel your temporal mandibular joint. So if you could open your jaw for me. Good. Close it. Open again. Good. Some clicking noted on the right side, but it moves smoothly, no restriction and no limitation. If you could bring your jaw forward for me. Good. Good. Very good. Okay. Now I'm going to go ahead and look at your face. Nice and symmetrical. Let's see. Feel for your skin. Nice warm skin. Go ahead and look in your eyes. I'm going to bring your lids down, so if you could look forward for me. Look up. Nice pink conjunctiva. And now I'm going to look up above. And the same nice and pink conjunctiva. Good vasculature, and her sclera are nice and white. Okay, very good. I'm looking at her pupils now. They're nice and round, equal, regular. We're going to check her accommodation and light reactivity. So look straight forward for me. Good. Very good. So pupils are reactive to light, and we will check her accommodation as we check her extraocular movements. Look at my finger and try to follow it, okay? Very good. Okay, so extraocular movements are intact, and look at my finger again. Keep following it, keep following it. Okay, and eyes are accommodated. Okay, so now we'll go ahead and move to the ophthalmoscope. So I'm going to go ahead and look inside your eye and your retina, okay? So all I need you to do is look straight forward for me. I'm going to look at your right one first. Good red reflex, good vasculature, Optic disc margins are nice and sharp. Look at the other one. Red reflex present in this one as well. Good vasculature, nice pinkish reddish color. And optic disc margins are nice and sharp. Okay. So now we will move on to your ears. I'm going to look inside your ear. Your outer ear looks good, no abnormalities. Some cerumen present. Tympanic membrane is translucent. Landmarks are visible. Cone of light looks good. Okay. And now look at the other side. The other ear looks very good. No abnormalities. Minimal cerumen present in this one. External ear canal is nice and pink. Tympanic membrane is translucent. Landmarks visible. And cone of light is good. Okay, very good. Now I'm going to go ahead and look inside your nose. First I'll feel the outside. Let me know if you feel any pain.
No.
No, the bridge of the nose is nice and straight. Tilt your head back for me. I'm going to look inside. Her right ear is nice and painted. Some discharge present. Nice and painted. Okay, no septal deviation noted. Same for this side. No congestion, nice and painted. And a nice pink color. No septal deviation. Good. Okay, now we're going to go ahead and look inside your mouth. You can get the tongue blade. Stick your tongue out for me. Okay, very good. Buccal mucosa is nice and pink, moist. Say ah. Good. Good. Okay. Tonsils are not swollen. They're nice and pink. No redness. I'm going to look at your cheeks. No lesions noted. Nice pink and moist. Good dentition. Okay. I'm going to go ahead and test your gag reflex as well. Open your mouth for me. Okay, good. Good. Okay. Now I'm going to go ahead and feel your gums to see if there's any tenderness, okay?
Okay.
Okay. So I'm just going to feel around. Let me know if you feel any pain as I palpate.
No.
Good. And up top. Good. Stick your tongue out. Touch the roof of your mouth with your tongue. Very good. Now stick your tongue out. Turn to the left side, to the right side. Good. Okay. So now we're going to go ahead and check your sensory neural and bone conduction. Okay. So I'm going to tap this, put it on top of your head. Let me know if you hear it equally in both ears or just in one, or better in one ear, okay? Equally in both ears. Okay, very good. And this time I'm going to go ahead and tap it again. I'm going to place it on your mastoid process, which is right behind your ear. Okay. Let me know once you stop hearing it, and then I'm going to move it outside your ear, and then let me know when you stop hearing it, okay? Stop. Okay.
Stop.
Okay. You still hear it?
Mm-hmm.
Okay.
No. No.
Okay. Good. So normal bone conduction and sensory neural hearing. Okay. So now we will go ahead and move on to your lungs and your chest. I'm going to go ahead and listen for anything. Okay. So First, I'll take a look at your chest. Your AP diameter is less than your lateral, so that's very good. I'm going to check your thoracic expansion. Put my hands on your 10th rib. Breathe out for me. You take a big deep breath in and breathe out. Sorry. Big deep breath. Okay, very good. I'm going to go ahead and do that in the front also. Again. Okay, so good. Equal bilateral expansion of the thorax. Let's see, we're going to go ahead and percuss your lungs. So I'm just going to tap your back, your sides, and your front, okay?
Okay.
Good. Connect this arm for me. Good. Good. Very good. Now up front. Okay, so resonance heard all throughout. I want to go ahead and listen to your lung sounds now. So just breathe in and out for me nice and slow, okay? Lift up your arm for me. Good. Almost there. And last one. Very good. Clear breath sounds all throughout. Okay, let's see. Now I will go ahead and we're going to listen for your carotid artery. Good upstroke, no bruise heard. Okay, very good. Regular heart rate. Very good upstroke. Regular heart rate. Nice and strong. Pulse about at a 2. Okay. And no bruise heard on that side as well. So I'm going to go ahead and have you lay down for me now. I'm going to listen to your heart a little bit more. So first I'm going to feel your point of maximal impulse, which is right here between your 5th intercostal rib. Very good, nice and strong and regular. Now I will listen to your carotid pulse and feel for your PMI. Let me turn your head for me. Thank you. So the carotid upstroke is in sync with her PMI heart rate. Okay, very good. Okay, Now I'm going to go ahead and just listen to the other landmarks of your heart. So I'm going to listen to your aorta, your pulmonic, second pulmonic, tricuspid, and your mitral valve. She has a good, strong heart rate. Regular rhythm. Okay, very good. Now I'm just going to feel for any kind of thrills. So I'm going to feel at the apical border. No thrills felt. The left sternal border. No thrills. And at the base of the heart. No thrills felt there. Okay, very good. And now we're going to go ahead and move to your abdomen. If I could, I'm going to lift up your shirt, okay? So you're going to inspect her abdomen first. It's nice and flat, not distended. No mass is seen. There's slight pulse seen at the epigastric or aortic pulse. Okay, I'm going to go ahead and auscultate for bell sounds. Normal bell sounds heard. We're going to go ahead and listen to her major arteries in her tummy as well. So we'll hear the aorta, her left renal artery, right renal artery, her right femoral artery, left femoral artery, and her right iliac artery, and her left. And no bruise are heard all throughout. Okay. So now I'm going to go ahead and percuss your abdomen. Slight dullness noted over the liver. Okay, and the rest is tympanic. Okay, so I'm going to go ahead and palpate. Go ahead and breathe in. Breathe out. Lower border of the liver is palpable, about 2 centimeters below the costal region. Okay, and go ahead and breathe in again. I'm going to try to feel her spleen. Breathe out. And her spleen is not palpable. Okay, I'm going to go ahead and feel the rest of your tummy. Any tenderness?
Mm-mm.
No mass is palpable. Okay, very good. And if she had shorts on, I would go ahead and feel her inguinal nodes while we're here as well. Looking for any redness, any tenderness, also on both sides. Okay, so now we're going to check your hip mobility. So if you could go ahead and pick this knee up, good. Turn it out to your right, bring it into your left, good. And then also if you could bring your heel right above your leg, and then rest your legs back down. No pain?
No.
Okay, good. And then also I'm going to ask you, try to resist my hand. Push up. Good. And now push down. Good. And then do the same with your foot. Try to push up with your foot. Good. And down. Good. Okay, so we'll do the same with this side. Go ahead and bring your knee up. Push it out to the left, to the right. Good. And then bring your heel up and relax your legs down. No pain in your hip? No?
No.
Okay, good. And then go ahead and try to resist my hand. Good. And now down. Good. And now your foot. Good. And down. While we're here I'm going to go ahead and try to feel for your dorsalis pedal pulse. Pulses are equal at a 2, nice and strong. So now we'll feel for your posterior tibial pulse. Nice and strong at a 2 for both. Okay, very good. I'll have you sit up now. And then now while we're here, we'll go ahead and have you, if you could bring your heel all the way up to your shin and touch your knee. Good. And do the same thing with the other one. Very good. Good movement. Okay. So now if you could turn your ankles. Sorry, your ankle. Yeah, very good. If you could face your soles in and now out. Good. And then with your wrist, do the same. If you could touch your fingers to your thumb. Very good. Good accuracy. Okay. And then what I'll have you do is push against my hand. Try to bring your arm forward. Good. And now down. Good. And I'll just check your range of motion here. Good. And now here. Very good. No pain. No crepitus. Okay. Do the same thing here. Try to pull it up and down. Good. No crepitus noted. And then now make a circle with your arms. Very good. And then I'm going to go ahead and check your joints of your fingers. No swelling, no tenderness. Very good. And then also check your feet. Your skin is, your toes are a little cool. Your hands are warm. Okay, very good. And then for your fingers, we'll go ahead and check your capillary refill. Nice and brisk. Nice and brisk. Okay, and your toes as well. Nice and brisk. Okay. Nice pink color. Okay, very good. Okay, now what we'll do is we'll check your sensation. So I'm going to start with your face. Let me know when you feel the cotton ball. Close your eyes.
Okay. It's soft. Soft. Soft.
Good. Okay, now I'm going to go ahead and do the sharp and the dull. Have your eyes closed.
Okay.
So I'm going to touch your hand. Let me know if you feel sharp or dull, okay?
Sharp.
Dull. And now to your feet.
Sharp. Sharp.
Good. I'm going to go ahead and check for the Babinski reflex, so just relax your foot.
Okay.
Negative. And negative Babinski reflex. Okay. So now have your hand out for me. I'm going to draw a number on your hand and let me know what it is. Have your eyes closed. Okay? Do it the other side.
8.
Good. And on the other hand.
1.
Very good. Okay. So now what we'll do is I'll have you stand up. If you could walk in a straight line for me. And walk back. Good. Now walk in a straight line again, but keep your feet in line with your toes.
Okay.
Very good. Okay. And now I'm going to have you close your eyes, stand with your feet close together, and just try to stay still. Very good. This is a negative Romberg test. A negative Romberg sign. Okay. And now open your eyes, and if you could stay on one foot for me. And now the other one. And now switch. Try to go quick. Okay, good. And now what I'm going to have you do is close your eyes, have your hands out, and then tap your nose with your finger. Okay? And alternate. Good. A little faster, and then as fast as you can. Okay, it's good accuracy. Okay, very good. I think that's it. Yeah. Okay, thank you.
Totally gonna check.
Oh, let me check your spine here. Okay, if you could go ahead and bend forward for me, try to touch your toes. Okay. So good curvature in the spine. And I'm going to go ahead and feel. Let me know if it's tender at all.
No.
No? Okay, good. Okay, I think this completes our physical exam. Thank you.
Thank you.
I don't know what else I forgot. I think the alcohol.
But you
But I didn't have it. Yeah.
You did everything.
Hmm?